Okay, good morning or good afternoon all. Um, Sorry for the little inconvenience. I had some problems on my MacBook to talk to you about the multidisciplinary approach of domestic violence and child abuse, but it seems it's in order now. I get assignments by the chat that you can hear me, so I will continue and look at the chat if there is a problem. I'm Pascale Franck. I'm from Belgium. I work for the Family Justice Center in Antwerp, which I will explain in some minutes. And the purpose of this workshop is to go further into the multidisciplinary approach of domestic violence and child abuse and the impact of the COVID-19 crisis. Please, can I have the next slide? Okay, thank you. First, I want to tell you a little about my work. The Family Justice Center is a one safe place for victims and for survivors and their families of domestic violence, child abuse, and unrelated violence. And here in Antwerp, we are 10 years at work. In this Family Justice Center, it's not a model that started in Antwerp. There are more than 200 Family Justice Centers worldwide. It started in the States, in San Diego. But we developed a model also in Europe in a pilot project from the Daphne, most of you know. And what we do is to offer a multidisciplinary approach, everything survivors need to stop the violence and to get back control over their lives, to be empowered and to work on all life domains that feeds further violence. So we work on housing, on counseling, on relationship with children, on debts, on people without papers, and so on. In Belgium, there are 3 active family justice centers, and other regions are in development. And at this moment in Europe, there are 14 family justice centers active, so we're quite small. Another important thing about Family Justice Center that it's not a copy-paste model. It's about taking everything that you have and that works well and bring it all together. For example, the team in my center in Antwerp, Belgium, has 45 co-workers, but they're all detached from their own organization. We have people coming in from police, from justice, from women's aid, children's aid, child abuse center, counseling, probation, you name it. And we all work together very intensively on violence. Okay, thank you. Next slide, please. So the purpose of this workshop is to talk about the impact of the COVID-19 lockdown for victims of domestic violence and child abuse. Next slide, please. And what we saw is that certainly in situations of coercive control, the lockdown had a big impact. When victims are forced to stay at home and in the immediate and constant vicinity of the perpetrator, this offers perpetrators many opportunities to exercise control. For example, not allowing the victim to go out because she can catch the disease, or we saw cases when she had to go to work, that she wasn't allowed to see the children, to be in the same room as the children, because she could bring in the virus and things like that. Also, it gave perpetrators under coercive control situations also the possibility to cut further off social connection. So the social distancing was also used in quite some cases to widen the gap between the victims and her friends, families, and so on. Social distancing that is imposed means that perpetrators of violence can take advantage of an already stressful situation to gain even more control. When you are locked up together in the home and you don't have other things to reach out, this makes stressful situations even worse. Victims often were trapped in a situation where they are required to stay indoor rooms with the perpetrators, and that makes it very difficult to reach out for help whenever it goes wrong, in every escalation of violence, and also cut them off of resources that can help them. For example, meeting your friends at school wasn't possible anymore, so help also there was cut off. And we had quite some testimonials from victims in such situations who show various ways in which these measures were taken against the survivors. Yes, please, next slide. So we also measured the impact of lockdown situations and social distancing. And one of the first big things was that stress factors increased in the family. When you are on each other's lip all day, when you cannot go out, when you don't have much possibility for emotion regulation, things can become very heated. But also the loss of work for a lot of people, victims and perpetrators, gave a lot of more stress factors. Loss of money, not knowing when it will stop, not having a long-term perspective, has a lot to do with increasing stress in families and in relationships. We saw thus an increase in frequency and severity of violence incidents in our region. For example, the helpline got the first 4 weeks already 70% more of calls from victims searching for help from within their homes. And we saw also an important rise of people looking to police, not the first weeks, first 4 or 5 weeks, but after week 5, 6, we saw quite an increase at people reaching out to police because the violent incidents grew a lot in severity. When a family doesn't have a violent situation, it's not because of the lockdown that they get violent suddenly, but it's more that in families where there were already tensions, where you already have these almost violent situations, that we saw a higher risk of aggravation and escalation. And in families with a lot of violence, we saw a huge escalation of violence. Victims were certainly in the first 2 months, we saw that victims were less likely to seek help. And there are numerous of reasons for that. One of the first things is that the media sent out quite early the message that everything was in lockdown. You couldn't go to counseling, police wouldn't come, we didn't have barring orders anymore because justice was closing down a lot of their activities. Police focused completely on behavior during lockdown, not see people, social distancing, and didn't go quite deep into family violence things. So victims got the message that there was no help. Of course there was, but the media took a big part in this to feed this idea. Secondly, victims often thought that it would be unsafe to go for help, not knowing if they would catch the coronavirus. And there was less help. When families reached out, counseling was closed. A lot of services didn't go on, for example, house visit, didn't see people face to face. So it was quite difficult to find help. Yes, please, next slide. What we also saw as impact of the lockdown was a more which I would call cooperative attitude of victims towards perpetrators due to the lack of possibilities to install safety. What do I mean when you are locked up with a perpetrator and you have no much opportunities to go out, to have safe calls, to reach out for your own safety? You will have an attitude not triggering the perpetrator. So you will be even be less powerful and be more cooperative at what he wants, what the perpetrator wants, just to keep your own safety or the safety of your children. We saw also that children witnessed violence and escalation even more because they were locked down with their parents in the home, not going to school, not seeing grandparents, and this had a big influence on trauma. And also the impact on the emotional state of family members. Lockdown gave a lot of fear, restlessness, depression, even suicidality because of loss of contact with others, but also fear for the job, fear for the money, and so on. And the toilet paper rush to the shops is a kind of sign that people were really worrying about their future and how it would be. And in families with a lot of stress, this impact was even bigger. Yes, please, next slide. Okay, so less opportunities and less variation in possibility for safety planning was a very important issue. I already called reduced numbers of barring orders or out of house placement of offenders. And we had to be creative with that when police and justice didn't write out barring orders or didn't didn't remove offenders from the house due to suspended trials, reduced police interventions, and there was also less availability of crisis help. This gave less opportunities in safety planning, and this was a very concerning issue in the first week, which we had to deal with. We saw also that crisis intervention teams focused on the here and now solutions, which is quite recognizable. In crisis situations, we saw our politicians do the same, have measurements for today, tomorrow, but not for a week after or 2 weeks. That's really connected with crisis situations. So also in situations of partner violence and child abuse, this meant that help was focusing on the here and now solutions for the escalation, but less longer terms planning, which is a very important measure to a very important pathway to tackle violence, the long-term planning, or what's the goals, how we are going to do when you only focus on the here and now. It's good in a situation of crisis, but it doesn't give much perspective for survivors at that moment. We also saw that survivors were quite hesitating of leaving home or going to a shelter, certainly the first 6 weeks. This hesitancy because of not knowing if it's safe. Do I catch COVID-19 there? In the beginning, there was the idea you could catch it on every corner. So going to a shelter, would it be safe? This withhold a lot of survivors of going to shelter places. But also more important was the idea, okay, when I go to the shelter, can I return home whenever I want? When I feel it's not, I want to return, can I even return because of the COVID-19? And also the lack of possibilities to go to family and friends. So often people go first a few days to shelters and try then to find resources and shelter at family and friends, but this was also cut off. So the idea was, when I go to the shelter, I can be there stuck for weeks and not having any possibility to return or to go to a more personal place. And also shelters were quite full. because less survivors could leave because of the lack of opportunities. Social housing was not seeing anyone, and going to, as I already said, to family friends as an alternative was also not possible. So the shelters were full and there was no much people leaving. So that gave us a lot of stress in finding places for survivors who really had to leave the house, knowing that there was no outplacement of offenders. Yes, next slide. So we very quickly had to turn to a complete alternative way of working on the Family Justice Center. And here I could really feel the difference of working in a multidisciplinary setting, because I saw our team very quickly adapt to the new system. In 1 week, they had set up a whole telephone and virtual contact with victims. And they gave, as I already told, priority to crisis interventions because there was so much escalation, but also lack of opportunities to install safety. And very important, there was a very proactive attention to at-risk survivors, families or relationships they knew they are at risk. They really reached out proactively to see if is everything okay, can we offer things, and to work out safe ways to have virtual contact or telephone contact using code words, using safe ways to have these contacts, knowing that people were locked up with perpetrators in the house. There was also an outreach to survivors who were already in the picture of the Family Justice Center to update the risk plans, how to the safety planning, because a lot of safety planning includes social environment, includes contacts, parents, friends, families, doctors, schools, and they were all with the social distancing and lockdown. They were all a lot further away from the families, so we couldn't be sure that we could count on the safety planning who was made before COVID-19. So there was an outreach to survivors to check if the safety planning was still okay or it should be adapted. Then the team went to sidewalk conversations as home visits weren't allowed anymore. They saw victims outside. They really made appointments on the sidewalk in open air to reduce the risk, or go on a walk with survivors, to have conversations in private, see each other face to face, which in a lot of situations of domestic violence is really preferable. There was an offer to the children, and we saw that the number of children in the families we work with were without internet. And it was a quite high number. Almost 1 out of 3 children didn't have access to internet, which cut them also off of schools and friends. So there was an offer to see the children, and also to make for children without internet, to make paper packages which would help them on different things, and gave them the opportunity to reach out if necessary. We, in the first week already, um, uh, uh, organized 3 times a week, every week, advice and support consultations for all kinds of professionals who were in contact with survivors and their families. So we really could give help and expertise in how to deal with violence during the COVID-19 lockdown. And also a lot of there was a lot of attention for the emotional regulation. I already mentioned the high raise in stress, in anxiety, in fear. So working on emotion regulation with survivors, but also with perpetrators, was also a very important thing to foresee safety planning and de-escalation of tense situations. And also a lot of communication and press releases from week 1, because whole there was this big message: stay in your home, social distancing. But when you are in danger or when there is violence in your home, you have to seek help. You have really to come out of your home, and that was an important message. And we looked up media to twice a week send out a message that in case of violence they could call the phone number for victims and for support, that we were available, that it wasn't so that there was no help available, and really reached out to survivors and their families. Okay, next slide. I also foresaw extra shelters. As I told, there was no place in shelters anymore, and crisis intervention became very important. So, together with the training center of a local authority and an hotel, we could free of charge foresee more than 50 extra units to host women and their children who, in a very safe place. And the photo you see is that in those places we had also a kind of shop for children where they could go and look for nice toys, and so which they also could keep. So there was a lot of attention for the children at the same place. Yes, next slide. So, practical guidelines for professionals during COVID-19 we focused on was install safety. Safety is very important when people are locked up together, when social distancing and there is lack of people and resources to organize a safe place. A very clear communication through media, through websites, through packages we delivered at survivors' places. Also, a very urgent call to involve social network, which we also did by, for example, media. Twice a week, we asked people if they were knew about people at risk within their family, with in their friends, for children at school, or for example, the family doctors with their patients, really to reach out. It was not because we have this social distancing, not social network didn't have an important role to play in tackling the violence, and really to send out this message that social network is crucial to help survivors. Organize this virtual multidisciplinary collaboration, including police and justice, gave the big opportunity that we could engage police and justice to take up their role quite soon. After 6 weeks, we had a weekly contact to see which families were at risk and how we could help police and justice to play their role, but also to involve them in the safety planning, which was quite important due to the COVID-19 measures. Creative solutions, for example, in terms of housing, and also very important to reach out even more than under normal circumstances to work proactively with families, to reach out, to call them, to have regular contact, and so on. Okay, next slide, please. Here I'm not going to read everything because of time, but we also provide safe virtual and a phone conversation, teaching, for example, survivors how to delete history of calling, chatting, using safe words to see if situation was safe to speak. You don't know if the perpetrator is sitting across the room. Trying to work with video where possible, and also with recontacting, use code words to be sure that it's safe. And also very important when you work virtually of a phone conversation, you don't have the nonverbal communication, which often gives you a lot of information about the situation of survivors, and to check and double check if the communication is really understood and if you understand very well what the survivor is telling, because what you see is not always what you get on these sometimes very fearful situations. Okay, next slide, please. Um, some numbers I already told that we in Belgium, in Antwerp, we saw a rise of violence. And for example, and that's also very worrying, the police in Belgium received 30% more reports of child abuse during Corona. Okay, next slide. As a last thing I want to mention is the Mask 19, the pharmacy, which was launched in first in Spain and in France. We also did it in Belgium. Working with pharmacy, I think it's a very good tool to work on awareness raising, to include pharmacists, but also, for example, family doctors, if you use code words, and that we even should use it more and work more on this field. We didn't see, there was no one referred with the Mask 19 during the last months to the Family Justice Center, but as idea, I really can subscribe it. But I think it's more a tool for awareness raising and to get other professionals like pharmacists and family doctors involved in helping out survivors who are at risk. Okay.